Hello students, good morning to you all. Today we are going to complete that particular unit number 4, Healthcare Delivery System in India. So from last few classes we were going through this particular unit. As you all know, we have studied a lot of things under this particular unit. So in this particular class, let us have a summary. So let us see what all we have studied in this particular unit. In this particular unit, we have studied about the healthcare delivery system, how the healthcare is delivered to everybody, to the population in India. So in that we have started our unit with various principles of healthcare delivery system. What are the objectives of healthcare delivery system? How they render the services to the population, and basically on what principle does they work. That all we have seen in the introductory part. I have told you in this particular unit there are so much of questions which is especially exam oriented. As well, this is one of the heart unit of community health nursing. So when we write an essay, or if the question is asking like, what is the healthcare delivery system in India, or what are the various healthcare delivery systems, so we have to start with public sector. So we have seen in public sector we have the periphery areas where the primary health care is provided, that is the subcenter and the PHC. And then we have the secondary cadres like CHC, rural hospitals, district hospitals. Then we have the tertiary centers like specialized hospitals or medical colleges. So these all includes in the public sector. Not only these two, we have the health insurance in India. This is also in public sector, because we all know that in Indian setup all the population is not covered under the insurance. So we have various government policies or public sectors where the people, those who are working in central government and state government, these people are insured by the insurance scheme such as ESI, Employee State Insurance, and CGHS, where the central government people are covered under the insurance, Central Government Health Scheme, CGHS. So ESI, not only the state government employees, the good institutions or the organizations, those who are having the policies of ESI, those who have taken up the ESI facilities, so they all will be covering under ESI. Employees state insurance. So ESI also we have already studied in very detailed form in the occupational health services under that particular unit. That is also a 5-mark question. It can be asked, what is employee state insurance? So what are the various benefits? So I hope you all remember the maternity benefit, sickness benefit, and disability benefit, and we have studied the funeral benefits. So many benefits we have studied under the ESI scheme. It is very, very important. So not only this two, under the health insurance we can highlight and tell about the railway health services, where all the railway employees are covered under that. They have their own hospital like railway hospital, railway clinic. They have their own health system, railway nurses, railway doctors. So they have a separate health sector. And even in the defense also, as we all know, in the defense, that means it comprises the army, navy, and Indian Air Force. So in these three sectors they also have their own hospitals or their own health services like defense hospitals, or as like command hospitals we can tell. So they have also primary, secondary, and tertiary levels. So they have small clinics, and they have referral hospitals where all the defense personnel and their beneficiaries, That means their dependents. They all can really take all the services rendered through the defense system. So these all you have to include in the public sector. If in exam they are asking only about healthcare, explain the healthcare delivery system in public sector. So this is all you have to write. Then private sector. So in the private sector, as we all know, same like how government is providing primary, secondary and tertiary care, same way private sector also they have their own sectors. Like for example, they have small polyclinics, they have dispensaries, they have private practitioners, or they have their own small clinics. We used to see the private doctors even when sometimes it is attached with their homes, or sometimes it may be as a separate clinic in the town or in the city or in the rural area. So the general practitioners and their clinics, and the same way we can see their referral hospitals also in private sectors, like very big hospitals, like we have so many like Fortis, Vocad, there are so many private institutions also. So in India, if we are telling, like we have Rajagiri hospital, we have in Ernakulam we have Lisi hospital, in we have Amarda hospital. So these all are the tertiary centers in the private sectors. So this is about the private sector. And the next area where the health care is delivered to the public, that is the indigenous system of medicine. So in indigenous system of medicine, as we all know, the government is trying to bring back the Indian system of medicine, that is the traditional Indian system. That means the Ayush, that means the Ayurveda, Siddha, Unani, homeopathy, and even along with that, all the naturopathy treatments, yoga, and the unregistered practitioners. Like we have, നമ്മൾ പറയാറില്ലേ നാട്ടുവൈദ്യന്മാർ അല്ലെ, അവരൊരു പ്രത്യേക കോഴ്സ് കഴിഞ്ഞവരോ അല്ലെങ്കിൽ അവരൊരു സർട്ടിഫൈഡ് അല്ലെങ്കിൽ രജിസ്റ്റേർഡ് ഹെൽത്ത് പ്രാക്ടീഷണേഴ്സ് ഒന്നുമല്ല, എങ്കിലും നമുക്ക് നമ്മുടെ ഒരു ഇന്ത്യൻ കൾച്ചറിൽ അതുപോലെയുള്ള ഒരുപാട് അൺരജിസ്റ്റേർഡ് പ്രാക്ടീഷണേഴ്സ് ഉണ്ട് അല്ലേ, നാട്ടുവൈദ്യന്മാർ, അവർ നാടൻ രീതിയിലുള്ള ചികിത്സകളൊക്കെ ചെയ്യുന്നവർ. ദെൻ ഇൻ നാച്ചുറോപ്പതി വി ഹാവ് സീൻ ഓൾ ദ മഡ് പാക്ക് അല്ലേ, മഡ് പാക്ക്, വാട്ടർ തെറാപ്പീസ്, സ്റ്റീം ബാത്ത് തെറാപ്പീസ്, അങ്ങനെ ഒരുപാട് നാച്ചുറോപ്പതി ട്രീറ്റ്മെൻറ്റ്സുകളുണ്ട്. ഇതെല്ലാം കൂടാതെ ആയുഷ് സ്ട്രീം. സോ ത്രൂ NRHM സ്ട്രീം നമ്മൾ കണ്ടിരുന്നു ഈ ആയുഷ് സിസ്റ്റത്തിനെ, ഒരു ഇന്ത്യൻ മെഡിസിനെ ദേ ആർ ട്രൈങ് ടു ബ്രിങ് ബാക്ക് ഇൻ ടു ദ allopathic line. That's why even in PHC at least there is one post for Ayush nowadays, at least one Ayurveda or one Siddha or Unani or at least one homeopathy doctor, any of the one will be present nowadays in the PHC and CHCs. Then this is about the indigenous system. This also can be asked for 5 marks. This is also very very important. Then the next streamline through which how the health care is delivered is various voluntary health agencies. So this also we have studied in detail. You all have to remember the definition of voluntary agencies. I hope you all still remember. If not, you have to read the textbook. This is all given in one particular unit. I hope it's unit number 22. So you all have to read the textbook. So what was voluntary health agencies? Try to recall that. So in the coming class, one day I will be coming in Google Meet so that I can have a discussion class. I should also know how much you are able to understand, or are you all following the various classes. So in voluntary health agencies, we all know that it is a autonomous board which is run, which is not coming under the direct control of government, and they collect the various fund through paid and unpaid works. So like we have various national and international health agencies. So the national health agencies we have already studied in this particular unit. The various voluntary health agencies in India, like in national level, it is we have studied about Indian Red Cross Society, Hindu Kush Nivaran Sangh, Indian Council for Child Welfare, TB Association of India, Bharat Sevak Samaj, Central Social Welfare Board, Kasturba Memorial Fund, Family Planning Association of India, All India Women's Conference, and various professional bodies. Then in the international level, we have various voluntary health agencies. So the health agencies in the international level, This comprises WHO, UNICEF, UNESCO. There are so many. We are going to study in detail about these all in the coming classes. So tomorrow onwards, I am going to start with the next unit, which is the health agencies. In that particular unit, we are going to study about all the international and national health agencies. So there I will not repeat the national health agencies since we have already studied in this unit. So there in detail we will be seeing about the international health agencies. Then the next form through which the health care is delivered to public is through the national health programs. We have various national health programs. So every year or every 5 years, the government has through the 5 year plans, they try to implement so much of new health programs by assessing the report of the last 5 years. So they would try to concentrate where the health sector is poorly performing, where they really need the improvement. So in such areas, either it is communicable or non-communicable, whatever, they would try to improve the health overall in India through various health programs. So here also we can see that there are lots and lots of health programs. So if we count itself, there are so much, but at least around 20 health programs we have to study. Why I have not explained in this particular unit is there is a coming unit for you only specifically for national health programs, around 20 hours. So you can see the importance there. So each program 1 hour. So there are so much of things we have to study in that particular unit. About all these programs we have to study, because any of this program can be asked in exam for 5 marks. Not only that, as a community personnel, you all should know about the various national health programs provided by Indian government. So here you can see, I'm not going to read all this. I hope you can read one by one. See, these all are various national health program. Don't worry, all these programs we are going to study in depth in the coming class. Only NRHM we have studied here, National Health Mission. So it has two parts, National Rural Health Mission and National Urban Health Mission. Only about that we have just seen in this particular unit. All the other national health programs, because why I have told that is you have to read about ASHA worker. I hope you all remember that. Accredited social health activist. All the other national programs we will be studying in the upcoming units. So these all were the various parts or various systems coming under healthcare delivery of India. So I have told, never get confused. There is a particular unit which Sister Smita is going to take. So Sister Smita will be taking about the health administration system in India. That is about how it is administered from the central government to the state government, then district, then rural, then the urban health services, how it is the structure or the administration. Here we have told about the various health delivery systems, how it is delivered to the people. So why I am again and again telling is, many times in the final exam, the students, they used to be very sad after the exam, because some of the students, they misunderstand the question and they suddenly started to write the opposite one. So if the health care delivery system is asked, you have to focus all these 5 things: private sector, public sector, indigenous system, all the national health programs, how they provide. So when it is asked as a essay, there is no need for you to explain all the national health programs as a whole, national health programs, and simply few example you can list down and you can just explain through national health programs how the government is trying to provide the health care, how to improve the healthcare system in India. And even Ayush also, there is no need for you to explain each and everything what you have studied under Ayurveda, what is studied under. So according to the marks, according to the lengthiness of the answer, you have to comprise your answer, but all these points should be incorporated under healthcare delivery system. Never confuse this question with health administration in India. That is different. That is central, state, district and panchayat. All those levels is coming under health administration. Then what we have studied in this unit? Then in this unit, we have studied about the Indian Public Health Standards. So what are the IPHS guidelines for sub-center, PHC and CHC we have studied. Again, I am telling, I have not given the whole notes for this, because these all things are very clearly given in KPAR textbook, each and everything. You have to study everything under this unit. Never try to again concise what is given in the textbook, because the core aspect is given in the textbook. So under Indian public health standards, what are the new guidelines given by the IPHS for subcenter for the improvement of PHC and the CHC? Because as per IPHS, we all know that in India, now the first referral unit is community health center, but they are trying to upgrade the PHC to the first referral unit. So in this area, you have to study about the first referral unit. Even we have studied the same thing under RCH2. I hope you all remember in the last unit, RCH2, we have studied about the first referral unit. So sometimes for 5 mark they can ask you what is first referral unit, what are the services, what are the conditions for which first referral unit should be. ഒരു പി എച്ച് സിനെ ഫസ്റ്റ് റെഫറൽ യൂണിറ്റ് എന്ന് വിളിക്കണമെങ്കിൽ അതിന് എന്തൊക്കെ സർവീസസ് റെൻഡർ ചെയ്യാൻ സാധിക്കണം. സോ വി ഹാവ് ടു റീഡ് അബൌട്ട് ദ ക്രൈറ്റീരിയ ഓഫ് ഫസ്റ്റ് റെഫറൽ യൂണിറ്റ്. ദീസ് ഓൾ യൂണിറ്റ്സ് ആർ ഇൻ്റർകണക്റ്റഡ്. So here you have to read, because Indian government is trying to strengthen all the sub-centers and PHCs. So they would try to make the PHC into the first referral unit. Then we have studied about the urban health services. We have studied about the various organization and how it is provided in the urban level. So in the urban health services, there are mainly 5 highlights which we have studied about: the postpartum program and the pap smear test facility which is available in the rural area, and the sterilization bed scheme where we have a reservation for the sterilization procedures like tubectomy and vasectomy, and we have studied about the urban revamping scheme, and we had urban family welfare centers. These all were the health services especially focusing on the urban area. So in urban area especially, the services rendered are family welfare services and the MCH services. So these two services especially, they have a separate wing for urban health. Then we have studied in this unit regarding the various job descriptions of community health personnel at various levels. So in this we have studied what are the job description of a medical officer. So if there is only one medical officer, if there is 1, 2, 3 medical officers also, their work will be the similar. Only thing, the senior doctor will be the chief medical officer, and they all have to work coordinately the same functions. So medical officer, we have seen what are their function, and we have seen regarding the male health worker and the female health worker, and then we have studied about the male and female health assistant. So here we have seen that there are some common functions should be done by both male and female, and especially what are the functions assigned for males, do you remember? Yes, all the outreaching services, especially where they have to go into the field area, especially for communicable diseases like malaria, leprosy, all the tuberculosis outreach services. So whatever they go outside, and the surveillance programs what they do in the area, that is mainly assigned for the male staff. And all the immunization and all the antenatal facilities, all the antenatal checkups and their immunization, everything is focused by the female staffs. Then we have studied about ASHA worker. ASHA worker, I have told you all to read. I hope you all have read in the textbook. It is very clearly given, because I don't want you to feed each and everything. Some things you have to open your textbook. If I give everything through slides, I wonder how many of you open the textbook. So you all have a KPARK in your hand. You have to open the textbook and read ASHA worker. What is ASHA? Accredited Social Health Activist. So there is assigned functions under the NRHM topic it is given. So ASHA, what is the work of ASHA along with ANM nurse, and what is the work of ASHA assigned with Anganwadi worker? So that is her job descriptions. And under the middle level health provider, in between I used to upload the notes. So in that I have told about the roles and responsibilities of a community health officer. That means the community nurse, as we all are community nurse. So already we have studied, you all have studied even in BSc second year, what are the functions or what are the roles and responsibilities of a community health nurse. The same way community health officer also the same things I have explained under middle level health provider. I hope you all know that it's a common thing which we all used to study in even BSc second year, the common functions and roles and responsibilities of a community health nurse. So these all health personals we have just reviewed in this particular topic, all the job descriptions. Then what we have studied in this unit, we have studied about health മാനേജ്മെൻറ്റ് ആൻഡ് ഇൻഫർമേറ്റീവ് സിസ്റ്റം അല്ലേ. മാനേജ്മെൻറ്റ് ഇൻഫർമേറ്റീവ് സിസ്റ്റത്തിൻ്റെ കീഴിൽ വരുന്ന ഒരു ബ്രാഞ്ചാണ് ഹെൽത്ത് മാനേജ്മെൻറ്റ് ആൻഡ് ഇൻഫർമേറ്റീവ് സിസ്റ്റം. ദ മാനേജ്മെൻറ്റ് ഇൻഫർമേറ്റീവ് സിസ്റ്റം MIS, that is actually for all the business sectors or all the professional sectors. In that, one among is the health sector. So where we all comes, where the hospital comes, where the clinic comes, where all the national health program comes, where the public sector, private sector, these all comes under. So each of they have their own informative system, where with the help of computers and with the help of all the health professionals, they do all the recording and reporting in this particular system, so that the integration of all the work will be happening in under one umbrella. So here we can see that by looking into this you will be getting an idea how we have studied. So all the planning, organizing, the staffing, directing, coordinating, controlling, all the work has been integrated into the management information system, where the health management information system comes. Especially what is the periphery routes, എങ്ങനെയാണ് ഇവർക്ക് ഡേറ്റ കിട്ടുന്നത്? ത്രൂ ദ സർവിലൻസ് പ്രോഗ്രാം, ഐദർ ആക്റ്റീവ് സർവിലൻസ് ഓർ ത്രൂ പാസീവ് സർവിലൻസ്. ആരാണിത് നടത്തുന്നത്? ഓൾ ദ മെഡിക്കൽ ഓൾ ദ നഴ്സിംഗ് പെർസോണൽസ്, ഓൾ ദ ഹെൽത്ത് ടീം പെർസോണൽസ്. നമ്മൾ അവരുടെ ജോബ് ഡിസ്ക്രിപ്ഷൻസ് ഒക്കെ പഠിച്ചിരുന്നു അല്ലേ? എന്തിനു വേണ്ടിയിട്ടാണ് നമ്മളവിടെ ജോബ് ഡിസ്ക്രിപ്ഷൻസ് പഠിച്ചത്? കാരണം എങ്കിലാണ് നമുക്ക് ഹെൽത്ത് ഇൻഫർമേഷൻ സിസ്റ്റമിൽ എങ്ങനെയാണ് ഇവർ ദ ആക്റ്റീവ് ആൻഡ് പാസീവ് സർവിലൻസ് നടത്തുന്നതെന്ന് മനസ്സിലാവുള്ളൂ. So what was active surveillance? Through the home visiting or through door-to-door visit, they go and collect the informations. They search for the cases, whether there is any eruption of any epidemics. Any epidemics is going to start or what? Or is there any communicable disease happening in the various interior areas? This one can be find out only through active surveillance, the subclinical cases. Passive is the clinical cases, where all the cases come into the hospital. From the health facilities, they will be trying to take up how many fever cases came, how many tuberculosis cases has reported. So these two clubbed will get the total surveillance report, which can be entered into the health system. നമ്മളിപ്പോൾ പറഞ്ഞ എല്ലാ ടോപ്പിക്കുകളും ഇമ്പോർട്ടൻ്റ് ആണ്. ഏത് വേണമെങ്കിലും 5 മാർക്കിന് ചോദിക്കാം. സോ ഐ കനോട്ട് ടെൽ ദാറ്റ് ഇൻ ദിസ് പർട്ടിക്കുലർ യൂണിറ്റ് ദിസ് ഈസ് മോർ ഇമ്പോർട്ടൻറ്റ്, ദാറ്റ് ഈസ് മോർ ഇമ്പോർട്ടൻറ്റ്. എവറിത്തിങ് ഈസ് ഈക്വലി ഇമ്പോർട്ടൻറ്റ് ആൻഡ് ഐ ക്യാൻ അഷ്വർ യു ദാറ്റ് മിനിമം ദെയർ വിൽ ബി 3 to 4 questions from this particular unit for your final exam. And we have seen regarding the referral system. So referral system also I have clearly explained you, and I have given you a good definition also. See, we will not get any definition in any of the textbook. I just made like from my experience I have just tried to make a small definition I have given to you. You all have to read that. What is referral system? So I hope you all remember that. So here the sub-center and the periphery workers should come below the particular line. I hope the alignment has been changed when I have converted it into my mobile. So I hope you all can understand the primary care level. What is the primary care level? That is a sub-center level, where all the periphery workers, that means the village health workers, male and female, and the community health visitor, all the multi-purpose workers, all the ASHA members, all the trained birth dais, trained birth attendants, they all work in that periphery level. That is the primary care level. And from there the secondary care level, that is the PHC and CHC. And then we have the tertiary levels, that is the district hospitals and the specialized and teaching hospitals or medical colleges. So from one level to next level, if we are not able to meet the need, or if we are not able to provide the care, or if we have less resources, if we have limited services, if the case is serious, we have to refer from one level to the next level. That is known as the referral services. ദ സെയിം വേ ഇറ്റ് ഷുഡ് ബി ടു വേ ഓൾസോ, അല്ലേ? അസുഖം കുറഞ്ഞു കഴിയുമ്പം മെഡിക്കൽ കോളേജിൽ നിന്നും അവരെ ഡിസ്ചാർജ് ചെയ്ത് CHCയിലോട്ടും അവിടെ നിന്ന് പിന്നെ PHCയിലോട്ട് റെഫറൻസിനായിട്ടും വരാൻ അവരോട് പറയണം. സോ ഇറ്റ് ഷുഡ് ബി ടു വേ. എങ്കിൽ മാത്രമാണ് നമുക്ക് ടെർഷറി ലെവലിൽ തിരക്ക് കുറയ്ക്കാനായിട്ട് പറ്റുള്ളൂ. ബട്ട് മെയിൻലി വാട്ട് ഈസ് ഹാപ്പനിങ് ഇൻ ഇന്ത്യ ഈസ് ദേ യൂസ് ടു റെഫർ ആൻഡ് ഫൈനലി ദ കേസ് റീച്ചസ് മെഡിക്കൽ കോളേജ്. ബട്ട് ഫ്രം there again all the follow up, everything the patient used to go directly into the medical colleges only. Why? Because they trust the doctors they were there, because they got all the services from there. But the same trustworthy feeling they should get even in the CHC and the PHC through the various services and by the dedicated doctors. Then only the rush in the stream can be dispersed to all the periphery areas, and there will not be much rush in the tertiary center. And in the last part we have seen about the records and reports. So I'm not going into detail about record and report, because even in BSc first year onwards you are studying about recording and reporting. What are the principles of recording and reporting? What all things you have to keep in mind when you are recording something? Can you all recall something? Yes, I know that you all are very good students. You all will be remembering. So എന്തൊക്കെയായിരുന്നു? So if it is a good recording system, it should be continuous one, and it should be there should be clarity in entering the data. Date should be mentioned, time should be mentioned, signature of the person who is entering the data is must with the name and designation, and there should be follow up and maintenance of the records and reports. Once it is entered, it cannot be changed, and there should be weekly or monthly inspection about the recording and reporting. So all these things should be well maintained in the recording and reporting system. So the same what you have studied in fundamental, only thing here we are studying this under the community. So in community health center or in the primary health centers, കമ്മ്യൂണിറ്റി ഏരിയയിൽ നമ്മൾ എന്തൊക്കെ റെക്കോർഡ്സാണ് കീപ്പ് ചെയ്യുക ആസ് എ കമ്മ്യൂണിറ്റി ഹെൽത്ത് നേഴ്സ്? നിങ്ങൾ കമ്മ്യൂണിറ്റിയിൽ ആൻസർ എഴുതുമ്പോൾ എപ്പോഴും റോൾ ഓഫ് നേഴ്സ് എഴുതുമല്ലോ. അപ്പോൾ അതിൽ റോൾ ഓഫ് എ കമ്മ്യൂണിറ്റി ഹെൽത്ത് നേഴ്സാണ് കേട്ടോ നിങ്ങളുടെ മനസ്സിലോട്ട് ഓടി വരേണ്ടത്. ഒരു കമ്മ്യൂണിറ്റി ഹെൽത്ത് നേഴ്സാണ് എന്ന് നിങ്ങൾ സങ്കല്പിക്കുക. സബ് സെൻറ്ററിലോ PHCയിലോ CHCയിലോ വർക്ക് ചെയ്യുന്ന ഒരു കമ്മ്യൂണിറ്റി ഹെൽത്ത് നേഴ്സാണ് നിങ്ങൾ. അല്ലെങ്കിൽ നിങ്ങൾ ഹോം വിസിറ്റിങ്ങിനൊക്കെ പോകുന്ന ഒരു കമ്മ്യൂണിറ്റി ഹെൽത്ത് നേഴ്സാണ്. അപ്പോൾ നിങ്ങളുടെ റെസ്പോൺസിബിലിറ്റീസ് എന്തൊക്കെയായിരിക്കും? സോ വാട്ട് ആർ ദ രജിസ്റ്റേഴ്സ് ഓർ വാട്ട് ആർ ദ റെക്കോർഡ്സ് യു ഹാവ് ടു മെയിൻറ്റെയിൻ? So these are some of that: birth records, death records, antenatal records, newborn immunization records, under 5 records, communicable, non-communicable, national health records, referral system records. അല്ലേ, ഇതിങ്ങനെ ഒരുപാടുണ്ട്. It is not the full list which I have given. There are so many things, Indian books, so many things are there. So when we go to community postings, there also we can maintain and we can have a observation of all these records there practically also. So these all were the things what we have studied under this particular unit. I hope you all understood about this unit. If you have any doubt, you can call at any time. You all have my number, and I request you all have to go through the textbook. You all have to read that particular unit at least once today itself. So from tomorrow onwards, we will be starting the next unit, that is the health agencies. There we will be studying about all the international health agencies. Thank you, students.